I have been visiting Mauritius since 2010 for cardiac electrophysiological procedures here. So I visit the country say every 3 to 4 months. I come here and do some procedures. I specialize in cardiac electrophysiology. So the procedures that I do here are pertaining to the electrical system of the heart. So as we know, the heart has a blood supply and an electrical system. The electrical system of the heart is treated by specialists who are called electrophysiologists. The electrical system can sometimes beat very high or beat very slow, or some patients can have heart failure. So treatments offered for all of these problems are by people like us who are cardiologists and subsequent cardiac electrophysiologists. So the patients come and complain to us that they have feeling of palpitations. Suddenly they feel their heartbeat is very fast. So that is a problem called supraventricular tachycardia. Sometimes palpitations can also come as atrial fibrillation, where they complain palpitations, and sometimes the patients will complain of slow pulse beat. They feel drowsy, they feel dizzy, or they have fainted. So these are the classic presentations. However, there is a subset of patients who develop heart failure. That means their heart pumping ability comes down. When the heart pumping ability comes down, we are always afraid of sudden death and patients having swelling feet, inability to do activities of daily living, inability to go out for a walk. For those patients, we implant special devices called CRTD, cardiac resynchronization therapy defibrillator, or implantable cardioverter defibrillator, or simpler devices called pacemakers, depending upon what an individual patient needs. So whenever the palpitation is high, that's called PSVT, we take the patient inside the cath lab. We try and induce the palpitations in the lab. We bring out the problem. We identify the problem, and then we do what is called mapping. So we do electrophysiological study by putting wires inside the heart. It is done under local anesthesia. Then we map as to where the arrhythmia is coming from, and then we go and give heat energy, which is called radio frequency ablation. The success of a radio frequency ablation is about 98%, which is considered very high because we are potentially able to cure our patients of the disease process. So this electrophysiological study and radio frequency ablation is a potential cure to a cardiac illness. No other cardiac illness has a cure. If you have high blood pressure, you cannot cure it. If you have diabetes, you cannot cure it. If you have atherosclerosis, meaning blockages in the blood vessels of the heart, you cannot cure it. But when you have EP study and radiofrequency ablation, we cure it. So remember that for palpitations, there is a cure which is available and is unique. Social media has shown us that the burden of sudden cardiac death has increased, or we are seeing more of it because of social media. However, we have to understand sudden cardiac death, as the name implies, happens within 1 hour of onset of symptoms. So the patient is absolutely fine, he is in the gym and he suddenly dies, or he is found sleeping in his bed. So these are called sudden cardiac death. It is important to be remembered that more than 80% of sudden cardiac deaths happen because of disease in the blood vessels of the heart. The individual was not aware that he had some blockages in the blood vessels of the heart. They culminate suddenly as a heart attack, and the patient has abnormal rhythm of the heart, and that becomes very rapid, chaotic, irregular, no blood to the brain, no blood to the vital organs, and we eventually are faced with a very big problem that is called sudden death. So if we want to protect our patients from sudden death, it's imperative that they get themselves tested well in time. What is the meaning of testing? They must make sure their blood pressure is always less than 130/80. They must make sure that their fasting blood sugar is always less than 100. They must make sure that their cholesterol, the LDL cholesterol, is well within the range. They must make sure that they don't smoke, must exercise, should not have sedentary lifestyle. So, these are certain examples which we say that these patients should be careful about. Some people are genetically predisposed to developing sudden death. They need to see their cardiologist in time if there is a family history of sudden cardiac death. So, has the age changed? Yes, the age has changed. Why has it changed? It has changed because our daily living habits have changed, because of globalization, because of better economical standards. People are eating out, fast foods, smoking, alcohol, lack of exercise, sedentary lifestyle, taking your cars everywhere. All of this has pushed our blood vessels to develop blockages early. So, what used to happen at 60 is now happening at 30. Hence, it is a wake up call that all the young people, anybody who is above 20 must have his blood pressure checked, must have his blood sugar checked, must have his cholesterol checked, must exercise every day and look after the health very well. So, if the pulse is low and the patient warrants treatment, he can fall down, he can break a bone, have fracture, have head injury, so they need a pacemaker. And somebody who has fast heart beating, it can become very disturbing. The fast heart beating, if it is PSVT, they can have dizzy spells, they can fall down, and if it is atrial fibrillation, they can even have a devastating complication like stroke. They can develop heart failure because of atrial fibrillation. So, one must be aware that if you have any symptom which is out of the normal, you must visit your doctor. Doctors here in Mauritius are treating their patients very well. They are able to diagnose very well and offer the treatments. So, you must visit your local cardiologist and seek treatment. The basic test is an ECG during the arrhythmia, followed by an echocardiogram, followed by a Holter evaluation, which is 24-hour ECG recording. These tests give us the diagnosis and subsequently we offer the treatments. All pacemakers or CRT or ICDs are typically implanted under the left side collarbone. We make a pocket under the skin, we place the device under the skin, and the device is connected to the heart with the help of special electrical wires. These electrical wires and the device communicate with each other and help the patient live a longer life. These devices are operated by battery. These batteries can last anywhere between 9 to 15 years depending upon the device and depending upon the usage. We check the device every 4 to 6 months, and once the battery is depleting, we remove the device and give a new device. So, in the life cycle of a device, the patient must get his device checked every 4 to 6 months. I have been coming here since 2010. I have only been seeing the problem to increase. So, there are a large number of patients here who have palpitations. They have been well diagnosed by their doctors and we offer them treatment, they seek treatment. So, there is a large number of patients with this problem and we are treating them very well. In Mauritius, we have been implanting pacemakers, defibrillators, cardiac resynchronization therapy defibrillators. We have been doing radiofrequency ablation for SVT. We have also been doing radiofrequency ablation for atrial flutters. The results are rewarding and our patients are doing extremely well. So, when a patient's pulse rate is low, we implant a pacemaker. It improves the heart rate to what we want. If the patient is at a risk of sudden death, we implant a defibrillator. It is called implantable cardioverter defibrillator. It is like an emergency room in your chest or a very intelligent doctor sitting here. Whenever the patient is going to have an episode of sudden death, this defibrillator diagnoses it and treats it by giving either a painless therapy or sometimes a shock and brings the patient back to life. A cardiac resynchronization therapy defibrillator is for those patients who have heart failure, their hearts have become big and they have heart failure and they are at risk of dying suddenly. So, this CRTD sits there, makes the ejection fraction, the pump, heart pump better, also protects our patients from sudden death. All of these devices are extremely intelligent and robust. They last the lifetime of the individual for about 9 to 10 years and subsequently we replace them. These devices are so intelligent that they treat the patient, first they diagnose and treat the patient and make them live. So, they are extremely intelligent devices and we often call them medical marvels. Every adult who is above 18 years of age, if he needs this device, will be offered this device. However, in a pediatric population, that is younger children, pacemakers we very often do. The other devices like ICDs or CRTDs are very bulky because children are small, their bodies are small. We have implanted ICDs also in a 6-year-old child, but yes, with extreme caution. It's very important that patients who have cardiac devices should remember that they must get their devices interrogated or checked well in time. They will not sometimes be aware that the battery is depleted and it can become a catastrophe. So, every 4 to 6 months they must come back to their clinic and get the device interrogated.